Located on the northern bank of the Yangtze River in Jiangsu province, Nantong is known for its long-lived residents. Here, the average life expectancy is 84 years. Yet longevity brings its own questions. Today, some 2.5 million people in Nantong are aged 60 and above, more than 30% of the city's population. Caring for a rapidly aging society has become one of its most pressing challenges. In response, the city has been experimenting with new policies and new models of senior care. And at the center of that effort is 35-year-old Li Nannan. For the past 14 years, Li has worked on the front line of elderly care. By day, she is a head nurse at a nursing home, tending to seniors with limited mobility, Alzheimer's, and other age-related conditions. But Li carries another title as well. She's also a deputy to China's top legislature, the National People's Congress, or NPC. Each spring, she steps into the Great Hall of the People in Beijing, bringing her proposals and pushing for reforms to better support China's aging population. You're listening to Footprints. I'm Xingyu. In this episode, we follow Li Nannan's journey from caregiver to lawmaker and explore how this young policymaker is helping shape the future of aging in China.
I'm
Li Nannan, a frontline elderly care worker from Nantong Fu-Ai Nursing Home.
Before Li became a caregiver, she was a granddaughter. And her decision to work in elderly care was largely connected to her childhood.
When I was very young, my parents left my hometown to work in the nearby city of Suzhou, so I spent most of my childhood growing up with my grandparents.
Raised under her grandparents' care, Li developed a deep and lasting bond with the elderly. Her grandmother was a village doctor. As a teenager, Li watched her battle cancer with remarkable strength. Without proper medical support, her grandmother sometimes administered her own painkiller injections while seriously ill. Those moments left a lasting impression, and quietly, they began shaping the path Li would one day choose.
My mom once asked if I had ever considered working in healthcare, and I said yes without hesitation. I wanted to care for more people just like my grandmother did.
It was a promise made in youth. Years later, she enrolled in a local health vocational college, majoring in nursing. After graduation, she secured a stable position at a health examination center, where she worked for 2 years, mostly drawing blood. The job was steady and comfortable, but deep down, Li knew it wasn't where she truly belonged. In 2012, she resigned and turned to another opportunity, working at a nursing home.
Back then, there were hardly any nursing homes in Nantong that combined medical services with elderly care. People were familiar with traditional senior homes or welfare institutions, but specialized nursing homes were still new. Even though I studied nursing, I didn't fully understand what a nursing home involved. I was curious, and I chose to join mainly because I would be caring for elderly people.
For the then 22-year-old, it was a leap into the unknown. But her first challenge wasn't the demanding tasks, such as helping residents with bathing, toileting, or clearing airways. It was language. According to Li, each of Nantong's districts and counties has their own dialect, and for her, communication became the hardest part of the job.
That was actually the main reason why I wanted to quit during my first week. In 2012, many elderly residents didn't speak Mandarin, so when I spoke Mandarin, they couldn't understand me, and when they spoke their dialect, I couldn't understand them.
But Li wasn't a quitter. Instead of leaving, she started to learn, picking up dialect words from colleagues, residents, and their family members. After 3 months, she could understand what the elderly residents were saying. After 6 months, she could speak their dialect herself. And with language came trust. Understanding their words meant understanding their needs. And speaking their dialect brought her closer to them. But communication is only one part of the challenge.
In addition to seniors with physical disabilities, we care for many residents with Alzheimer's disease. Their memories are fragmented. Sometimes they hit us because they can't control their emotions or temper. Many of them need to take multiple medications, and when they resist, we have to find ways to gently persuade them. For some young caregivers who may never have been hit by their parents, being struck by an elderly resident can be very hard to accept, and some chose to leave.
Li says, it's not unusual to see caregivers jogging behind a resident with Alzheimer's in the hallway, trying to convince them to swallow a pill. Over time, Li and her colleagues developed their own methods, crushing pills into powder and mixing them into soft bread, turning medication into something less frightening. Years on the front line have shaped Li's understanding of what elderly care truly demands: compassion, patience, and attentiveness. 3 simple words, but in this field, she says, they're indispensable.
Elderly residents often ask the same question over and over again. You have to listen and answer patiently each time. It's similar to caring for children. When I first started, I wasn't very patient either. You explain something once and later they ask again. Then a day or 2 later, they ask the same question again. Over time, the job really trained my patience.
Li admits there were moments when everything felt overwhelming. During night shifts, alarms would ring without warning, sending staff rushing from room to handle emergencies. At the same time, other residents would call out for help, some confused, some anxious, some simply asking the same questions again and again. All of it could unfold at once. But Li says it is precisely moments like these that have smoothed her rough edges. In a place where time moves slowly for some and far too quickly for others, she has learned to listen, to repeat, and to pay attention. And in the process, she has grown alongside the people she cares for.
那更多的让我其实体会最深的话就是我刚来这边上第一个夜班的时候就遇到老人去世。
On my very first night shift, an elderly person suddenly passed away. The scene struck me deeply. I had experienced my own grandmother's death before, but witnessing the passing of another person who felt like a grandparent still left me completely at a loss. I didn't know what to do.
As Li built close bonds with the elderly residents, saying goodbye was never easy.
很多人也都会说就是作为养老行业的话，应该是
People often say that in elderly care, you learn to take life and death lightly as you get used to it. But in reality, it's harder for us to accept. We see them every day. Sometimes we spend more time with them than with our own parents. So when one of them passes away suddenly, it feels even more heartbreaking.
伤感更加的难受。
Among the many residents Li has cared for over the years, one remains especially unforgettable.
我们有一个姐姐，她是四川的那边
He was a retired veteran who had devoted his life to the cause of national defense. For decades, he lived and worked in another city. When he finally returned to his hometown in Nantong, he was all alone, no family by his side. In his later years, he was diagnosed with Parkinson's disease. Later, brain atrophy affected his memory, and his thoughts became fragmented. Yet one memory never faded. He believed he still had a son, and he waited and waited.
Near the end of his life, we asked a colleague to pretend to be his son. We told him, "Your son has come to see you." When he passed away, a single tear rolled down his cheek.
It was a gentle lie, but in that moment, it gave him peace. Lee says, even today, she and her colleagues would talk about it.
We often share his story with new caregivers who join us. We hope it reminds young people to stay grounded and committed. Not every job shows results immediately. You have to put down roots to truly do it well.
Lee's workday starts at 8 a.m. After the morning shift handover, she conducts morning care routines, checking residents' skin for pressure sores, inspecting feeding and urinary tubes to make sure they are secure, and administering medications and treatments. At lunchtime, she often steps in to assist caregivers with feeding residents, especially those with swallowing difficulties. In the afternoon, the team organizes activities accompanying the elderly and keeping them engaged. At present, the company Lee works for operates 4 nursing homes in the city. Together, they care for around 800 elderly residents, with most of them living with serious medical conditions.
About 70 to 50% of our residents have suffered a stroke. Many others have Alzheimer's disease. After a stroke, seniors gradually decline, from partial disability to being fully bedridden. Some require feeding or urinary catheters. This is not unique to us. It's the reality in elderly care institutions across the country.
Over the years, Lee has also observed another change inside the nursing home. More and more elderly residents are using smartphones and tablets to make video calls, watch short videos, and handle mobile payments. Caring for seniors today means more than assisting with bathing, meals, and medical needs.
Nowadays, it's not enough to just take care of their daily needs. You also have to teach them how to use smartphones, how to operate touchscreens, how to download apps, which ones are safe and which aren't. We're constantly explaining new things.
This year marks Li Nannan's 9th year serving as a national lawmaker. In 2018, at just 28 years old, she was elected as a deputy to the National People's Congress, the youngest representative from Jiangsu province at the time. But stepping into the national political arena was a different kind of challenge. At first, she wasn't fully familiar with what the role required: how to conduct field research, how to draft policy proposals, how to speak on behalf of the people she represented. Even simple things like what to wear to the 2 sessions in Beijing felt unfamiliar. Li says it took her an entire year to truly find her footing. Following her first term, she was re-elected to the 14th MPC in 2023. Over the years, Li has submitted many proposals to the MPC annual sessions. Among them, one took 6 years to be implemented.
As nurses, we have licenses and professional titles, but in the elderly care sector, caregiving professionals do not have such a system.
During her first year as a deputy, Li conducted field research in nursing homes and care institutions. She found care workers were earning modest salaries and there was little opportunity for career advancement. For many young people, the message was discouraging. The work carried heavy responsibility and emotional strain, yet recognition and long-term prospects were limited. Ultimately, some chose to leave, while others never considered entering the field.
所以从2018年开始呢，一直在提，就是希望能够将养老行业的护理人员
From 2018, I repeatedly proposed establishing a professional title framework for elderly care workers. Finally, in 2023, Jiangsu became the first to implement such a system for elderly care professionals. When it was officially introduced, I felt truly excited and happy.
6 years of research, revision, explanation, and persistence. And then change. Before the reform, a caregiver could work for decades and still hold the same title simply as a care worker. There was no formal pathway to distinguish a newcomer from an experienced professional. Now, under the new system, caregivers can advance step by step, building careers with clear progression, recognition, and standards. For Li, the goal is to transform caregiving from a job of necessity into a profession with dignity and long-term appeal. She says such a system is about to be implemented nationwide in China. In addition, Li has also focused closely on long-term care insurance, a program designed to cover part of the cost of daily living assistance and basic medical services for people with disabilities. In 2016, Nantong was among the first 15 pilot cities in the country to introduce the policy, easing the financial burden for thousands of families.
它这个长护险的政策的话，就是还是挺好的。长护险它这个政策
Long-term care insurance is funded through local government subsidies. In Nantong, for example, an elderly person with moderate disabilities living in a nursing home receives a monthly subsidy of 1,200 yuan. For severe disabilities, there are two levels. Level 2 receives 1,500 yuan, and Level 1, the highest level, receives 2,100 yuan per month. For most elderly people from working-class families, this makes care more affordable.
Over the past several years, Li conducted field visits to neighboring cities, local towns, and even residents' homes, comparing how long-term care insurance is implemented across Jiangsu and other regions. And she discovered that coverage standards were not the same. Subsidy levels varied from city to city, and in many cases, benefits could not be transferred across regions. To address these gaps, Li submitted a proposal at last year's 2 sessions, calling for unified national standards for long-term care insurance, as well as cross-regional recognition of benefits to ensure that elderly people could continue receiving support no matter where they live or relocate. According to the National Healthcare Security Administration, as of the end of 2025, long-term care insurance has been implemented in 49 cities nationwide, benefiting more than 3.3 million people with disabilities. The number of designated long-term care service institutions has exceeded 8,800, and the workforce of nursing professionals has grown to around 300,000. Still, the challenge remains significant. China currently has about 35 million elderly people living with disabilities, accounting for more than 11% of the senior population. That number is projected to rise to 46 million by 2035. Authorities say the country will continue expanding long-term care insurance nationwide and introduce supporting policies in the coming years to meet the growing demand of an aging society. For this year's 2 sessions, Li has set her sights on cultivating the next generation of elderly care professionals. Her proposal focuses on transforming health-focused vocational colleges to better serve the rapidly growing senior care industry.
今年的话提的是关于希望能够将卫生高效像康养
This year, I proposed transforming health-focused vocational colleges toward wellness and elderly care. As population aging becomes an undeniable trend, the demand for senior care professionals will only continue to grow. I believe we should promote the transition of health vocational colleges into institutions centered on wellness and senior care so we can accelerate the cultivation of high-quality talent.
A recent industry report jointly released by leading Chinese universities and elderly care institutions shows that more than 80% of caregivers for the elderly are between the ages of 40 and 60. Within the next 5 years, the nationwide shortage of elderly care workers could exceed 5 million.
那目前其实我们现在我们国家的养老护理员队伍的一个缺口呢，
There is a significant shortage in our elderly care workforce, and many caregivers are in their 40s, 50s, or 60s. Educational levels are relatively low, and professional training can be limited. That's why I advocate shifting medical-related programs in vocational colleges toward wellness and elderly care. These colleges already have faculty specialized in nursing, pharmacy, medicine, and human anatomy. They are well positioned to meet the growing demand for professional senior care training.
康养学校的一个对接口。
Looking ahead, Li hopes to see more advanced technology integrated into elderly care, and more importantly, more young people joining the profession.
也希望能够以自己的这个年轻的全国人代表，能够带动更多的养老行业的年轻人员加入到这个。
As a young NPC deputy, I hope to inspire more young people to join this profession. Perceptions are beginning to change. Years ago, many who studied nursing left for other industries, but in recent years, more people are reconsidering. They are willing to learn, to engage with seniors, and to explore this field. I hope to attract even more young talents to build their future here.
老人去接触到这个行业里面。
From the corridors of her nursing home in Nantong to the national stage in Beijing, Li Nannan's journey has been guided by a simple but steady belief that dignity in old age is not a privilege, but a responsibility shared by society. As China's population ages, the challenges ahead are immense. But for Li, the answer begins with people, by training better caregivers, building stronger systems, and ensuring that seniors are cared for with patience, respect, and compassion. With that, we come to the end of today's episode. Thank you for listening. If you'd like to hear more inspiring life stories, be sure to find us at radio.cgtn.com or on major podcast platforms. Just key in footprints, and you can find more stories anytime, anywhere. I'm Xingyu. I'll see you next time. Bye for now.